Welcome, everyone. My name is David Hacker. I'm the Eastern Sales Manager with Lintas iQueue. Thank each and every one of you for taking time out of your very busy day to learn how some of the leading healthcare facilities, such as UC Health in Denver, the Cleveland Clinic, are using iQueue for operating rooms to optimize their block allocations and that entire block management process. So just a couple of quick housekeeping notes before we get rolling. First, this is a very high-level overview of the product. Our iQueue for operating rooms does have a lot of variability. In a 30-minute time period, we can't really get into a whole lot of detail onto that variability, but hopefully at the end of our session today, we have sparked enough interest where you'd want to set up a conversation with us and talk about what's happening going on in your facility and make some things that may be a little bit different than the way we kind of are presenting things today. So please remember that we do have a lot of variability within our product and hope to have those conversations to discuss what those are. As you're probably aware, you are on mute, but we do want to make this as interactive as possible. You each should have a chat window on your screen. As we go through, please feel free to submit questions via that chat mechanism, and we'll try and take a few minutes at the end of our session today to answer as many questions as we possibly can. Next, later on today, after we finished up, you will be receiving an email from us. Within that email, there'll be a link to the video of this webinar that you're attending today, so you'll be able to play it back for others possibly within your organization. In addition to that link to the video, there'll be other links we'll be sending you as well that we think you'll find beneficial in understanding who iQueue is and how we're able to help, again, optimize that block management process for your operating rooms. Today's agenda. First, we'll start out, just give you a brief overview of who Lintas is. Lintas is the name of the company. iQueue is the name of our product. And then we'll look at the 4 issues that iQueue does address. And we've broken the product down into 4 different modules. That would be a mobile block exchange, smart performance tracker, smart block allocation, and smart staffing. We'll take a view into each one of those 4 modules. We'll talk briefly about data requirements and connectivity, and then, of course, the ROI expectations that you can get, our commercial arrangements, and then, again, hopefully have some time for some questions, and then wrap up with our contact information as well. So an overview of who Lintas is. We're a Silicon Valley-based software company. We provide world-class intellectual property following lean methodologies and data science and apply that into the healthcare market space. You can see on the right-hand side some of the logos of a handful of our customers. So what we do is we leverage advanced technologies and data science to improve the efficiency in, obviously, the highest profit center department within the hospitals, and that would be the operating room. Today, we currently have available 2 commercial products. One is our infusion center, which is installed in about 50 major cancer centers across the nation, and our operating room product, which we'll be spending the rest of our time with today. We also have what we call our iQueue Labs, where we're testing out new ideas and new thoughts and new ways to look at things. Right now, we're looking at imaging, laboratory, pharmacy, and bed management. And if any of those you think might fit into our methodology and how you're doing things with our advanced data science and mathematics, please let us know. We're more than happy to kind of let you know where we stand on those products. So, you know more than we do that healthcare is changing. You have to do more with less. You're having pressures from a cost perspective. The competitive market space is changing, and then, of course, the quality shifting from a volume-based to a value-based care puts a lot of pressures onto the different administrative and leaders within the departments of the hospital. The 4 issues that iQueue can solve for operating rooms. First off is block release and request. Sometimes surgeons forget to release their blocks. Other times you have new surgeons who may be looking for block, so we can work on that process with you. Reporting. Reporting can be very time consuming. It's backward looking. Sometimes it's hard to access. It's not predictive at all. It's just showing you what happened a month ago. And sometimes there's also the single source of truth question that comes up with some of the reporting. Block allocation, driven by block utilization, which we have a little bit different flavor on, which we'll cover a little bit later on in our presentation. Sometimes it can be often challenged by surgeons that are political and influence-based. And again, we were able to provide some data to back that up. And then staffing. It's not uncommon for the ORs to run into extraordinarily long overtime hours, but at the same time, earlier in the day, the idle time of those same nurses who are working overtime factor in as well. So we can help with that as well. So our approach to our product is we have 4 distinct modules. These modules are independent of each other, and it's whatever fits for your facility we can work with. If all 4 of these modules are of interest to you, that's great. If you look at it and maybe there's only 2 modules, that's fine. We can mix and match and use 1, 2, 3, or all 4 modules, whichever fits for your facility as you purchase and or implement. The first one we're going to talk about is our mobile block exchange. And what this mobile block exchange is, it really makes it easy for surgeons and their designee, their clinics, their schedulers in their offices to release and request blocks. The problem is that oftentimes there's limited visibility into the OR as to available blocks. Faxes are sent, emails are sent, phone calls are made, notes are written on grease boards. So sometimes that visibility as to what blocks may be available may not always be readily available for the surgeons and or their staff. And what our mobile block exchange does is a very quick and easy process to request and or release blocks either on the web portal, and it also has automated release reminders. We're going to show you some detail behind that. If you've ever used OpenTable to make a dinner reservation, it kind of is similar to that in that you can look at times, and if that time's not available, they offer up suggestions as well. So we'll kind of show you a little bit more to how that looks within our mobile block exchange. First, we send proactive text out. The image on the left-hand side, it's reminding Dr. Jones that he doesn't have any cases scheduled for 4/21. These reminders, is from a timing perspective, is definable by each individual facility. You can send out multiple reminders, say 2 weeks out, 1 week out, 5 days out. We realize that a lot of the EMRs, they have automatic processes, but we like to take a little bit more proactive approach and send those reminders out sooner rather than later. So that way other surgeons do have access to those blocks. And in this instance, this came via SMS text because it doesn't include any PHI. And so the surgeon can look at this and he can just go directly, click on the link at the bottom and go directly to that particular block and be able to release it with one touch. Now, these reminders can go to the surgeon and or their designee. If they want to send it just to the scheduler and they want to be out of that loop, that's fine. We can send it to both. Doesn't make any difference however that individual surgeon wants to set it up. And it's a surgeon definable process, not necessarily facility definable. So if one surgeon wants to handle it, that's fine. If another surgeon wants to go to a scheduler, we can set it up that way as well. So it's a very easy process to release those blocks. Now, to claim a block, again, the surgeons can they can have visibility as to blocks that are available. It can be done again by themselves or the schedulers. The communication for this is just extraordinarily smooth. No more back and forth emails, phone calls, faxes. More blocks actually get, we call it saved. It can also be defined as used, and more cases are actually done with this. And there's a shorter wait time for the patients to have their operations. To claim a block, first off, the facility can set up and layer rules as to who has visibility to that individual block. So let's say a surgeon, an orthopedic surgeon releases the block 2 weeks out. The one rule can be for the first week, only the same service line, in this case orthopedics, would have access to be able to request that block. And then you can open it up to a broader audience after that. And you can layer as many rules as you would like on top of that. Now, there is a human element involved in the block request. So let's say a surgeon does request a block. As soon as that block is requested, it comes off of the market space, if you will, and then comes to the hospital master scheduler, where they have, as you can see in front of you, they would have a screen where all of the block requests are in front of them. And so that way, the master scheduler can make sure all of the resources are available. And that way they can make sure that the staffing is there, make sure anesthesia is available, if there's any specific equipment that may or may not be needed, make sure all that's done before that master scheduler approves or denies that block request. And if they approve it, they just click one click, they hit approve, and then it will then notify the surgeon and or his and her designee that has been approved. If it's denied, there's an opportunity to explain why that block request has been denied. It may be anesthesia is not available or specific equipment may not be readily available for that time period. So there is a human element, a human touch involved to make sure that the request and block, that everything flows smoothly within the facility. The next module we're going to take a look at is our Smart Performance Tracker. And this provides very timely access to actionable KPIs and alerts. Oftentimes, there is, with different reporting tools, a lack of transparency, lack of a single source of truth, and also a huge lack of timeliness. Our solution is our KPIs are sent out via SMS, text, and or email, and or available via the web, just kind of upon each surgeon. And it's a very easy to read, very informative as to the exact data that's involved. There's two parts of the Smart Performance Tracker. The first one is the surgeon view. We'll cover that first, and then there's an administrative view as well. There's sister reporting, just a little bit different on each one. First, let's take a look at the surgeon dashboard. We are showing this on a mobile device, and it can be received via mobile device, via tablet, on a computer, via email, SMS, text. Again, something that's configurable by each individual surgeon. So the first thing they're going to receive is, in this case, it's a text, and you can see there, it's telling Dr. Hemmings what his key KPI data is. And so he can take a look at it, and if that's all he wants to do, that's fine. He moves on. But if he wants to dig down a little bit deeper, all they have to do is click that link, and it opens up to their individual Smart Performance Tracker. So when they first go to their performance tracker, the first thing they're going to see is the utilization, and they can see that's the first KPI that they see. They can drill down from there, and they can see each day's details. The image on your screen, left on the left-hand side, kind of shows the overall view and it's for the past week. These messages are sent out every Monday morning to include data from the previous week. So it is timely. It is about as live as we can get as far as being able to provide those KPIs back. So in this case, 86% block utilization. You can see the number, the details that make up that below that. And then the second one on the right-hand side is rankings. Now, in this case, what we're showing, in this particular case, Dr. Amy Hemmings is ranked number 9 out of 47 for block utilization at 86%. And we're showing the different percentiles and where all the different block owners fall within that percentile. We've had a request from one of our facilities, and we certainly can do it. So again, it's a facility definable thing. We can actually show the individual block owners and rank them accordingly. Dr. Hemmings is at number 9 at 86%. Dr. Jones is number 10 at 85%, and list all that down. We do know that sometimes some of the surgeons might be just a little bit competitive as far as these types of data elements are involved. So one facility has asked us if we can do that, and yes, the answer is yes, we can. And if you can see across the bottom of each image there, they can look at their utilization, they look at their individual volume, the delays, where they are at blocks, and we have additional elements as well that they can dig down into. Now, you have the administrative dashboard. Again, a little bit very similar to the surgeon one, but this provides the total overall for the facility. And this can go out to all of the peri-op and or hospital administrative team. So that way they can see exactly how that utilization is flowing throughout the entire facility. Within each of these text messages that go out and being able to view this is they can drill down to see the individual surgeons if they so desire. So from a hallway conversation, hallway meeting perspective, if you have your mobile device and you're meeting with Dr. Jones, Dr. Jones says something about the utilization or those type of things, 2 or 3 clicks of the button, you can tell Dr. Jones exactly where he's at, and Dr. Jones will all receive that. So the conversation moves from how are things, Dr. Jones, to I know how things are, Dr. Jones. It can be set up for the chairs of each of the service lines to receive all of the surgeons that they are accountable for as well. So there's many ways we can configure that to make sure that all of the leaders have the appropriate information. And again, it gets sent out every Monday morning for the past week. Even from their mobile device, they can drill back into past history as well. They can look at the overalls and look at the individual block owners as to how that utilization or whatever KPI they're investigating, and they have that data in front of them immediately. This is just again a very small sliver of the web dashboard for the administration. We have a number of different tiles, if you will, and you can drill down, you can see trends, you can compare where you were from 2 years ago, 3 years ago, if that data is available, and we have that loaded up from you. You can drill down and see the individual surgeons, drill down and see the individual service lines. I could probably spend 30 minutes just on this one piece that we offer. Our next module that we're going to discuss is our smart block allocation. Overall concept for this is the right surgeon, the right block, and the wrong day. As you're allocating blocks, and you may be doing it quarterly through your committees or whatever your process may be, it's always a challenge to rebalance those. And sometimes you say, well, you know, if you hear being told that sometimes if those utilizations are below 70%, they're going to drop, a block or whatever your process is. It's always a difficult conversation because sometimes the surgeon may not fully understand all the data that goes behind it. We will provide predictive analytics to identify underutilized blocks and then project utilization of new allocations and then provide that objective insight for that reallocation. We take a little bit different flavor, and utilization for us is, yes, that's an important component, but we've coined the term, and some facilities we've spoken to have kind of the same concept. They call it a little bit different name to it, but we refer to it as collectible time. And the short description of what collectible time is, it's time that is realistically reclaimable where additional cases can be scheduled into. If you have a neurosurgeon that has an 8-hour block and he has a case that lasts 7 hours and 15 minutes, is that other 45 minutes really usable and someplace where you might be able to get a case in? Generally speaking, no. Certainly there may be times where you can, but generally speaking, that 45 minutes is not really reusable. The way we do things, it's a very surgeon-centric view. It does expedite the block allocation review and that decision-making process. It's a very easy to use. The tools that we use are very visual, very simple to understand and to read, and they are highly customizable, so that way you can fit it into the policies and definitions within your facility. There's always going to be higher utilization, lower overtime within your staff, and a culture of fairness and transparency. And yes, you will have more satisfied surgeons. I'm sure there are a few people chuckling at that, but I'll show you some things in just a second to support that statement. So exactly what is collectible time? And I just want to take a couple of moments to define what that is. You can see this Gantt chart that's populating here. The legend is, well, you see the blue blocks going through there. That's used block time. This example, they have one block every week. You can see the dates on the left-hand side. The gray, plain gray blocks are unused time. Obviously where it says released and you have the black lines, those are blocks that were released. So what we look at, and you see the little blue diamonds populate onto the screen, that's really what we would call non-collectible, i.e. non-usable time. You can't really reallocate that time, 15 minutes there, 45 minutes there, again, generally speaking. What we want to look at is collectible time, and that's where you see the red diamonds populate onto the screen. This is where, yes, you can offer this up to another surgeon. This is time that can be used elsewhere within the facility. So that's what we get into the block allocation itself. This is what we're looking for, is that collectible block time. Obviously, you'd want to address, in this case, the surgeon is releasing for 33% of their block, they're releasing them. So those are conversations that, again, we can provide the data on, and you can have those conversations with the surgeons to make sure that they have the right block at the right time. It is fully configurable. You can define what that continuous and what that threshold is to define collectible time. Most of our facilities use 4 hours. I'm currently working with one facility that wants to use 2 hours as collectible time, so that's how we're kind of managing those pigeonholes, is within that 2 hour window. You define what's best for your facility, and we can customize it and set it up to whatever is best for you. Then, of course, we provide all the data here. You can see a lot of the data we provide both in graphic formats and in the actual numbers for that collectible block time. Our next module that we'll quickly review is our smart staffing. That's exactly what it does. It provides an optimized staffing plan to minimize overall cost. This image that you see on screen left, that's a heat map, if you will, of how your OR, how an OR might look for the actual use of each individual room, and that's what we would provide. The middle image is kind of the way things typically we find our staff within the facility. The image screen right is the way our optimized staffing schedule would look after you implemented it. It would be a little bit different than what that center section is, because we want to try and limit that overtime and make sure that the idle time is minimal as well. Again, it's all based on data science and history and predictive analytics. We also provide you with a simulation what-if game. So as you can see on your screen here, you can kind of see on the left-hand side is the current plan, and you can see the hours that they're currently using. They have 18% of nurse time is idle, 10% hour overtime for the nursing. Optimized Plan A would save them about $400,000. Callback reduction by 5%, cost reduction by 10%. Idle time has gone from 18% to 8%, and overtime has dropped from 10 to 6. And you can kind of see the staircase down on how the recommended staffing would be. If you have any constraints with your staffing levels, i.e. possible labor agreements, we'd factor all that into how we would then present you back with the different staffing tools. We are a SaaS model software. We don't need interfaces. We don't need HL7. We don't need Fire. We use data extracts. It's a very light touch from the IT side. So whatever EHR you're using, be it Epic, Cerner, MedTech, Allscripts, we're agnostic when it comes to the EHR. We want historical data, and that data gets extracted and then uploaded to us either daily or weekly, kind of depending upon which module you're using, through a secure FTP site. Those are referred to as flat files, and they're CSV, basically Excel spreadsheets that get exported out. The reports can be automated to where no one has to actually run the report and send it to us. It's an automated report that gets uploaded. And then we take that information, run it through our optimization, and then push it back either through the Smart Performance Tracker, the Mobile Block Exchange, Smart Staffing, or the Smart Block Allocation. So what does your ROI look like? Hard ROIs over on the right-hand side. First, let's start with Mobile Block Exchange. You can see the values and the quantifiable benefits. An example for an ROI for a 25 OR hospital. You can see kind of the math as it works down. We would expect that for Mobile Block Exchange, you're going to garner an additional 500 blocks per year. The Smart Block Allocation, it's a better portfolio block for the right surgeon, the right room at the right base. And we feel, again, from here, you can see the math over on the right-hand side, you're going to receive the benefit of about 500 blocks a year from that. And again, this is kind of what we expect from a 25 OR facility. The Smart Performance Tracker, that's just going to drive culture of a data-driven, that everything's being driven, the decision-making is being driven by data. and not by politics or not by seniority, but driven by data. The smart staffing, very simple. We expect an 18 to 20% reduction in your labor costs from that as well. You can see the benefits across your team. It'll benefit the entire peri-op team. Everything from anesthesia to the surgeons, IT and analytics find this very exciting for them. The quality, lean, and PI teams, they can see a clear improvement in the processes. The nursing and staff love it because they're now right-sized. They have reduced overtime, reduced callbacks, and reduced furloughs. Our pricing, over on the left-hand side, you'll see what the benefits are. It's very simple. For all 4 modules, we will expect you to receive a $40,000 to $80,000 per OR per month uptick. And you can see the levels below for where that numbers might fall, the 10 to 20 OR range, the 20 to 30. You can see where those numbers fall. The actual pricing, as we provide individual fingerprints for the block optimization, we would do the same thing from our pricing perspective. We need to sit down with you, figure out what modules you want, how many ORs you have. Our pricing is based on the number of ORs that you have. Our pricing is, our contracts are month to month. We don't confuse customers and hostages. You go month to month. If you don't like it, you can walk away. And you can see what those approximate costs are. It's structured to set up a 5 to 10 times return of your investment within the same year. And we are so confident that our optimization is right for you, that we will implement it and get you set up and get you running. And in the first 120 days of going live, if you're not happy, we will return every single penny that you paid for us. No questions asked. Now, we can be flexible when I say that. If you install all 4, but maybe one of the modules for whatever reason just isn't fitting for you, then you can just back away from that one module. We're not an all or nothing proposition. Now, let's see if there's any questions that have come in. So while we're kind of viewing what those questions may be, I thought it might be beneficial if you can see what some of your colleagues are saying about our organization and about iQueue. We have people from the peri-op leadership team. We have different surgeons, anesthesiologists that we're showing quotes there. So please take a moment and read through that. Okay, we don't have any questions. So what I'm going to wrap up with is, again, thank you very much for taking time out of your day to join us today. You will be later on this afternoon receiving an email with a link to the video of this webinar, along with links to a few other interesting things. I strongly encourage you to please talk to us if there's any interest or you see there might be some value that what we can bring to your facility. We'd love to have a conversation with you and find out exactly what's going on at your facility. We thank you very much for attending, and we hope everyone has a tremendous and great day. This webinar is concluded. Thank you.